Good afternoon, everybody. I'm Liz Charlotte, Director of Communications at the Mississippi State Department of Health. Thank you for joining us today. I wasn't anticipating another press conference so soon. We have a new variant strain to talk about. Dr. Thomas Dobbs, our state health officer, will discuss this new strain, which is the South Africa strain. And our state epidemiologist, Dr. Paul Byers, will then discuss the other strains that we have and how we're doing tracing and surveillance on these various strains. So, and I also want to tell y'all, these numbers will be updated weekly on our website. So you'll be able to go weekly and see where we are on these different strains. Why don't we throw it over to Dr. Dobbs, and can you talk to us about the South Africa strain and how it's going to affect vaccines?
Yes, thank you, Liz. So today, the State Department of Health is reporting a case of the South African variant, or the South African strain, also referred to as B1351. This is a strain of the virus that has some characteristics that are very concerning for us. So far in the United States, we've seen 142 of these, so this is not entirely unexpected. 25 states or DC have now reported cases of this, and we are now added to that list. One of the reasons why this is so concerning is there is decreased effectiveness of the vaccine against the strain, specifically the AstraZeneca, which is not that applicable to us, but the Johnson & Johnson does show some decreased activity. Initial information shows that probably Moderna and Pfizer do have largely retained activity, but we haven't seen real world data about how effective the vaccines are in the United States against this variant. So something that's somewhat concerning, not surprising, but a strong reminder that we are not remotely out of this, and we still need to exercise some basic caution. You know, simple stuff, wearing a mask in public, avoiding large indoor social gatherings, still very, very important. And now's your time to get vaccinated. Even though Johnson & Johnson did show some diminished activity against this strain of virus, it did show significant, about 50-50 preventing any clinical illness, but was also very strong in preventing severe hospitalization and death. Not as good against the other strains, but still very effective. And we are hopeful, and initial evidence shows that Moderna and Pfizer are effective. So please get vaccinated now and take simple precautions to prevent the spread of COVID. Dr. Byers?
Thank you, Dr. Dobbs. And so, just to talk a little about our surveillance efforts that we do for identifying variant strains in the state. And this has really been ongoing since the fall and latter part of 2020, when a number of variant strains of concern were first identified. And we work with CDC and submit samples to them on a weekly basis for sequencing to identify potential variant strains of concern, as well as other variants that may be developing. We also work through CDC with a number of reference labs that also perform sequencing on state residents. We are soon to have the capacity to do sequencing within our public health lab, and that will vastly increase our capacity to do sequencing, as well as with working with some contracts that we're putting in place with university labs and reference labs throughout the state. So as many states are, and CDC is, we are continuing to ramp up our surveillance for variant strains in Mississippi. And we identified and reported our first variant strain that we identified back in mid-February, and that was the UK strain, or the B117 strain. Since that time, we've identified a total of 10 cases of B117 throughout the state. And we are going to be, as Liz said, reporting those out on our website on a weekly basis, just to keep folks updated. One of the important things that we want to do from a public health standpoint is make sure that when those cases are identified, that we do a complete investigation around them to make sure that appropriate isolation is occurring, make sure the contacts are appropriately under quarantine, as well as to do additional testing to determine if there has been any further transmission or spread. We haven't identified that yet with the B.1.1.7 cases that have been reported, but in many cases, those investigations are ongoing. And with the new South African variant that we are reporting, our investigation is still ongoing as well. But, you know, from a public health perspective, I think it's important to remember that you need to continue to do those things that we've been talking about since the very beginning. And one of the ways that we prevent the variant strains from taking hold and becoming significant is reduce overall transmission of COVID within the state. And the ways that we can do that are continue to utilize masks when we're in public spaces, you know, avoid those larger gatherings, make sure that you get vaccinated. And now's the opportunity. The things that we can do to limit transmission are going to help us blunt the impact of the variant strains in Mississippi. So stay tuned. More information will be coming out. Thank you, Dr. Dobbs.
Hey guys, thanks to both of you. I think at this time, we're going to take it to the chat room. We were having a little bit of difficulties, but I think we're up and running now. So let's start. I think Nick Juden is first. Let me see here. Well, all right. So let's go ahead and start. This is from Nick Juden. My understanding of the Johnson & Johnson study from South Africa was that it is found 100% protection from hospitalization and deaths after 28 days. Paul, you're shaking your head.
Well, and I think that's consistent with what Dr. Dobbs had said, is that we know, and this is very similar to what we see with influenza vaccines as well, especially when there's some genetic drift where a vaccine may not be completely effective at preventing clinical illness, but is very effective at preventing the severe outcomes and hospitalizations and deaths that occur with the infection. And we're seeing something very similar with many of the vaccines and the variant strains. Just another very important reason why we need to make sure that especially the most vulnerable in our population are adequately protected with vaccination.
Okay, I think you covered some of this, but I do want to read the entire question to you. Can you talk about the difference between effectiveness and preventing mild, moderate cases and effectiveness at preventing the worst outcomes of COVID-19? Should this encourage or discourage people from getting the vaccine? Finally, if someone was infected with more common variants of COVID-19, how much protection will those antibodies provide against this new variant? Why don't we take that first one, Paul, first, the difference between effectiveness. Hey, Paul, I think you're muted.
Was muted. Thank you. So, you know, when you look at the studies and when you look at the data that is being collected to determine vaccine effectiveness, you can look at it in a couple of different buckets. You can look at, is it effective at preventing that clinical infection? Is it effective against preventing an infection that either has mild to moderate symptoms or disease? And then you can look at what is the effectiveness at preventing those hospitalizations and deaths. And so you're really looking at a couple of different things. And you know, in some cases, when it's not as protective against clinical infection, it's important to remember that an individual who's infected, even after they've been vaccinated, may still be able to transmit infection. So that's why I think it's important, even after we've been vaccinated, if you're in public places, you need to continue to wear a mask. But when we talk about really what is the impact that we're trying to have, and that is to limit the morbidity and mortality from infection, protect our healthcare system, protect the vulnerable population. I think that is a strong encouragement to continue to get vaccinated. Not only do we want to protect our loved ones, but we want those folks to be protected. And if they get a clinical illness, but don't have to go to the hospital and don't have a severe outcome, that's a win. Dr. Dobbs?
Yeah, no, and I think it encourages us to get vaccinated, right? But it also reminds us that we're not out of this. So I think it should be a dual encouragement to go ahead and get vaccinated because you don't want to die, right? But we do see this transmission occurring in the community. So we need to make sure that we do simple stuff to, protect the vulnerable, to protect your family. We didn't think this was going to be over anytime extremely soon, although we're able to do a little bit more. This is time for common sense precautions.
Okay, guys, I think Nick, we answered that last part, but if you feel we haven't, just write me back. All right, Steve from Super Talk, hello. How much easier does this strain spread compared to the original strain of the UK or the UK strain?
Yeah, so, they both seem to be a little bit more transmissible. We have a lot of information on the UK strain. We've had a lot more of that in Mississippi and in the country. It may be 50% or so more contagious. And there was just an article released today from the journal Nature that shows that the UK strain may be more deadly, significantly more deadly. So things to be concerned about going into the future. They both have shown some evidence of increased contagiousness, and that's why we got to be extra cautious and get vaccinated.
Okay, thank you, Dr. Dobbs. Quentin Smith, do we know how many cases of the South African strain have been identified in Mississippi? I think that it's 142 cases, if I'm correct.
No, that's in US. One in
Oh, I'm
Mississippi.
sorry. He's saying in Mississippi. No. Okay, sorry about that. Don't get scared. Okay. No, he's talking about which counties did they come from, and which we will have on the website, but did you guys want to say those counties again?
Well, sure. The South African variant that we identified is from Harrison.
Harrison County. And the 10 UKs we'll have up on the website.
You bet.
shortly.
You bet.
Okay. That would have been worrisome, 142 cases. Sorry about that, guys. Kate Cornell, has the vaccination rate so far notably increased? Are we on the right track to slowly but surely working our way out of this? I'm going to throw this first to you, Dr. Dobbs.
Yeah, I think we're on track, but we don't need to let it stall, right? Certainly, there was phenomenal demand going into this, but then we saw a pretty significant drop of cases, and in part related to the success of the vaccination effort. But we still have, even though we have 60% or about 60% of our 75 plus folks vaccinated, we still have about 40% that are not. So we need for everybody to get protected to prevent those unnecessary hospitalizations and deaths. And then we also need everybody to get vaccinated. It's not just about, are you going to get sick and die? Are you going to get sick and go in the hospital? Are you going to give it to your relatives? Are you going to have to miss work because you're on quarantine? If you're vaccinated now, you don't have to quarantine if you're exposed. So if we want to get back to normal operations, normal sense of prosperity, we need to get more folks vaccinated.
Okay,
Dr. Byers, would you like to add anything?
No, I think Dr. Dobbs was right on track. I mean, when you look at our vaccination rates for the entire state, and we've had that information up on our website now, I would encourage folks to go and look at the data that we have on our website by county, which we've added the percent of the total population that's received one or more doses or have been fully vaccinated. I would encourage you to take a look at that.
Okay, thank you, Dr. Byers. I just got a note that they're having a little bit of trouble hearing you, Dr. Byers. Maybe are you sitting close to the mic there? Okay, that might help a bit.
Hopefully so. Is this a little bit better for us?
Yeah, it does sound better. I think that should help. Okay, now Mel is asking, and it's okay, Mel, because other people could probably use this again too. So he had a little issue connecting at the beginning. So Thomas, just a brief overview of what you discussed, and then Paul, a brief overview of what you discussed, just the main points. People can hear it again.
Yeah.
Thomas?
Yeah, so Mississippi is reporting the first case of the South African variant in a resident from Harrison County. This is also referred to as the B1351 variant. This is concerning because we know that this is a form of the virus that may be more contagious, but also it does seem to have some resistance to some of the vaccines that have been developed, especially the Johnson & Johnson. It looks like it may have some diminished effectiveness at preventing symptomatic illness compared to the other strains. It does still seem to show some pretty robust protection against severe illness and hospitalization, but it's another challenge that we face because this is going to be would be a little bit more difficult to control with the vaccine and also our normal sort of prevention measures. So this is a double indication for us to go ahead and get vaccinated, protect yourself, protect your family, and to take common sense precautions such as wearing a mask in public and avoiding large indoor social gatherings.
Okay, thank you, Thomas. Dr. Byers, Paul, would you just do a quick review?
Yeah, absolutely. And basically we covered that, we've had ongoing surveillance for variant strains that's been conducted in Mississippi for a number of months since the fall in late 2020. We did report our first variant strain of concern identified in mid-February, and that was B117, or the UK variant strain. And we did report that out. And since that time, we've identified a number of other cases that were infected with the B117 or UK variant strain in Mississippi. And we are continuing to ramp up our virologic surveillance, or our surveillance, to actually do sequencing and look for these variant strains, so that we can do a couple of things. And one is for awareness, but one of the things we want to make sure that we do is investigate those quickly, make sure that the cases are appropriately isolated and their contacts are quarantined and tested, because obviously one of the big things that we want to look for is what is the potential transmission that's occurred. And it's important for us to look at a couple of things from that aspect, but to date we haven't identified that there have been any known transmission from the previous variant strains. But that is the concern. If you look at a number of states around the U.S., you've seen that the proportion of cases that are associated with a variant strain of concern are increasing. And certainly that's been seen in a number of countries as well.
Okay, thanks, you guys. Okay, Desiree is asking, what makes the South African strain so worrisome? What are the characteristics that concern as opposed to the UK variant? I think we kind of talked about this, but Paul, you want to just do a quick summary for Desiree?
Yeah, so it's certainly the increased transmissibility over what we would think of as the typical normal COVID strain. So that's one. It's spread more easily. It has shown some reduced effectiveness around the vaccines, and so the vaccines, the AstraZeneca, and in some cases the Johnson & Johnson, look like they may not be quite as effective at preventing illness. And in some cases, we see that there's some reduced effectiveness of some of the treatments, such as the monoclonal antibodies against the South African variant. And so, that's why we're reporting it out. We want to make people aware. We want you to know that, we've still got a ways to go. We've made some progress with this, and we've made some great strides with our vaccination efforts. We've seen our number of cases dropping in Mississippi. Certainly, we've seen our number of deaths dropping in Mississippi, but we still have some work to do to get ourselves past this. And the emergence of variant strains is one of the more concerning pieces.
Thank you, Dr. Byers. Let's see, Ben Marcus at Colorado Public Radio in Denver. We were expecting your question. It's a little off topic, but Mississippi has done well to limit nursing home deaths in this most recent large wave. what are some of the strategies that worked this time? All right, let's take it one at a time. The strategies. Thomas, why don't you start?
Yeah, so, like a lot of states, right, we were trying to take those precautions as far as preventing transmission, PPE, safety measures. We've been vigorously engaged. We've had teams that are 100% devoted to helping guide nursing homes to respond and prevent outbreaks. Certainly, we've followed the robust testing guidelines that were required, and certainly having folks vaccinated. So in recent weeks, we haven't seen the kind of mortality that we had seen previously. If you look at the 3 successive waves we saw throughout this pandemic, the first one was majority nursing home. The second one was a little bit less than half nursing home. And this last one was a small minority of nursing home folks. So some of it's accumulated knowledge, some of it is enhanced protocols, testing, and certainly I think the vaccine has made a huge impact.
I think that that does answer both of those questions. Ben, write me back if it doesn't. Kate, let's see. Slight tangent. Okay, over the summer, we learned that several testing labs were not reporting their daily positive case totals, which was misleading. Has that continued to be a problem, guys? Paul?
No, as our system has grown and matured, we have a very good and large network of labs and physicians throughout the state, reporting not only through electronic means, through electronic laboratory reporting, but also directly into our surveillance system.
Okay, Thomas, did you want to add anything? Dr. Dobbs?
Sorry, nothing to add.
Okay, we dealt with this yesterday and talked to one of the Jackson stations. But anyways, we've seen, this is from APT, we've seen longer lines and wait times at drive-throughs yesterday and today. Is any of that in correlation with expanding eligibility? I'll let you guys answer, but what I did mention to the reporters yesterday was due to canceling because of the impending bad weather, there was a little bit of confusion by some people that just thought they could show up the next day. And also we have added appointments because our main goal, you may have to wait a little longer if we want to get those shots in the arm. And Thomas, I'll start with you. Did you have anything to add to that?
Yeah, no, it's an appointment-based system. And so we need folks to try to come when their appointment is to maintain, smooth sort of laminar flow. But we did add appointments throughout the week to compensate for the appointments that were lost due to weather. And so we've spread that out over a week. So there will be more folks. But we've also seen a lot of demand. One of the things that we've discovered, and it certainly makes sense, is that people who want to get vaccinated quickly. Where before we saw people who were very willing to get vaccinated, 3 or 4 weeks from now, people want to do it now because there's multiple mechanisms. So we do have some appointments left in our scheduling system, but most of, all the ones that are like this week are filled up pretty rapidly. So there is very robust demand, and we expect that to continue.
Dr. Byers?
I don't really have anything to add except that, we're pleased as we have marched through the eligibility this year as we move through for vaccine. We've continued to be pleased with the fact that the demand for vaccine is high. And so I encourage folks to look at our website and make sure that they identify the multiple sources of vaccination that we have available in the state. And, if you can't get an appointment at a time that works for you at one location, please use that interactive map, reach out to those folks, make an appointment somewhere, just get vaccinated.
And there are so many opportunities, you all, for the public to get vaccinated right now. So if you can't get in with us, you can certainly go on our website and look at the other providers that are offering it. Also, remember with our vaccines, our appointments are scheduled 2 weeks out too. So when you look at it, some people say, oh, there's a lot of appointments open. That's because they're scheduled for a few weeks out. Let's see here. I think this is Desiree. Are they hoping for new vaccines or supplements to increase resistance to the strains like the South African one?
Yeah, there is active work looking at developing a new vaccine that would be more effective. And if you think about the ways that these vaccines work, you basically have a delivery vehicle and you have a genetic piece of information. Based on the advances in technology, it's not very difficult to change what that genetic piece of information is. And we think that it would be relatively simple in the grand scheme of things to reformulate the vaccine, cocktail, so to speak, such that it would be effective against strains. But we do know that they're looking at this very closely. We can prevent this, right? So if we can, everybody get vaccinated, right? Even if it's less effective, it's going to prevent, it's going to limit transmission and take those simple precautions. We're just not out of this yet.
Okay, from Nick. Have you seen any research on the vaccine's effectiveness at preventing long-term symptoms of COVID-19? I have heard that if there are certain potential mechanisms of long COVID, that the vaccine, I guess he's talking about long ongoing symptoms of the vaccine could actually treat, like viral reservoirs or fragments.
I know that those are theoretical mechanisms, but I haven't seen any evidence or any information that would say one way or the other. So I'm really not sure about that.
Dr. Byers, anything to add here?
I'm not sure of that either.
Okay, Quentin is asking, do either of the strains cause more severe illness or increased risk of death? We're kind of touching there, but Thomas, go ahead.
Yeah, so the UK variant in recent studies does suggest that it's more deadly, maybe even 61% more deadly, which is pretty phenomenal. So something to be concerned about. But fortunately, the vaccines we have look to be wholly protective based on what we've seen. The South African variant, though resistant to vaccines and more contagious perhaps, does not have any evidence of increased mortality. So yes, there is evidence for UK, no evidence to date for the South African variant.
Okay, thank you, Dr. Dobbs. Isabel Taft from the Sun Herald. Because the South African variant was seen in Harrison County, will there be more testing for it here on the coast? Let's start with that. Dr. Byers?
Well, we're gonna work through our investigation like we work through any investigation. And first and foremost, we're gonna work to identify if there's been any transmission of this variant strain in close contacts that are identified, and then we'll move out from there and conduct this like we would any other investigation.
Okay, and does the state have a target for number of samples it would like to be testing for variants moving forward, up from 75 per week reported earlier this week?
Yeah, we've got capacity to do testing that we're working on through a number of different mechanisms, both, like I said, through contracts that the Department of Health is working through to increase variant testing, but also with partnerships with CDC and with our own capacity. And so we hope to do in the coming weeks 200 or more through all of those different various mechanisms for variant testing. And it may well be that we have capacity to do even more than that.
And Paul, do we send those into the CDC or can we do that in our own lab?
We are going to have the capacity to do that in our lab, but we do send samples to CDC, and we have partnerships with other labs as well to do sequencing for variant strains.
Okay, and I was wondering, we've mentioned these counties, people need to follow, even if they've been fully vaccinated, all the guidelines. Thomas, Dr. Dobbs, do they need to be more careful, especially more careful in these counties where we've identified variants?
I wouldn't say more careful. If we found one, there's probably multiple, right? So it could be anywhere. It's kind of like with a lot of these things that we encounter. When you find it in surveillance in small numbers, it's probably an indicator that it exists in larger amounts elsewhere. I think we all need to be careful. I think if it's in Harrison County, there's nothing specific about that makes it more likely to be there. I think we just found it there. So everyone needs to be careful and cautious everywhere.
Thank you. Let's see, if there's less effectiveness with Johnson & Johnson vaccine on the South African strain, should people prioritize getting mRNA vaccines instead? Dr. Byers.
No, I don't think there's enough information to say that. Certainly, even in the United States and with updated data, there's now 180 of the South African strain cases identified in the US. It's still very limited. The best vaccine to take is the vaccine that you can get, the vaccine that's available at that time. I don't think that we have enough information to begin a prioritization of vaccine types.
Okay, Dr. Dubs, anything to add?
No, and we haven't really seen Pfizer and Moderna head to head against South African variant, so we don't have any assurance that it's going to be better. Just get the vaccine that you can, the one that you want to get as soon as possible.
Okay, Ben has another question about nursing homes. What does testing look like for Mississippi nursing homes? Do facilities use state lab or does state cover costs of private testing? Let's start with those two and then we'll go to the other ones. Dr. Dub, do you want to start?
Yeah, I think Paul has his pulse on that a little bit better, so I'll let
Okay.
Paul kick it off.
So it's a combination through a number of things. Nursing homes, especially if they have a partnership with a hospital or another healthcare facility, will have much of their tests done through that hospital system. And remember, we're talking about a couple of different kinds of testing systems for nursing homes. First, there's the routine monitoring type testing that occurs with some level of frequency that's based on the percent positivity rate for the county. But then there's also testing that's done specifically around outbreaks or suspected outbreaks. And certainly from the Department of Health standpoint, we have the capacity and many times do assist with that outbreak testing to make sure that we can get it done quickly and as needed. A lot of times though, the nursing homes are taking care of the testing themselves. And so this is a program that's matured and evolved over time. And our nursing homes have become pretty adept at doing testing now.
And have test turnaround times. I remember earlier on, we had elevated to 48 hours turnaround in our lab. What's turnaround time like now, Dr. Byers?
Many of the nursing homes are using several different modalities of testing that include rapid testing, which have a more immediate turnaround. And so the turnaround times for testing have not lately been a barrier to getting results and taking action.
Okay, this is from Isabel, had the person in Harrison County with the South Africa strain B1351 recently traveled outside the state? Dr. Byers.
We don't have any evidence of travel, but again, our investigation is still ongoing.
Okay, Nick is asking, will the more infectious UK strain potentially limit spread of the South Africa variant?
Boy, that's hard to know. Like if that became the dominant variant, there are just numerous forces at play, which with whatever one would potentially become the dominant variant. So I would not like to speculate on that.
Okay, Dr. Byers, did you have anything more?
Not really. You can look at and flu is not necessarily a good comparison, but even in flu seasons, we may have a strain that's picked up more frequently, but in a typical season, there are still multiple different strains that are circulating and causing illness at any given time.
Well, I gotta tell you guys, I'm not seeing any more questions, but we'll give it a chance. Thomas, why don't you, any last words to say today?
Yeah, so we've identified a potentially more dangerous variant in Mississippi now, but this is not surprising. It's something we've anticipated for quite a while, and we think we'll see more of it. This just reinforces our messaging, how important it is to get vaccinated and protected now. Time is of the essence, and we need to make sure that we continue with those simple prevention measures that are not very disruptive. Just wear a mask in public and avoid large indoor social gatherings. We've got a little ways to go.
Okay, thank you, Dr. Byers.
Exactly what Dr. Dobbs said. We're not out of the woods yet. We've made progress. I think we've made great progress. When you look at when our last reported nursing home death was, it was earlier in the month. And so I think that, with our continued vaccination efforts and continuing to use masks, physically distancing in public, I think that, we've just got to, now's not the time to give up. We still got work to do. So hang in there, and gosh, man, I think we're all doing a great job. Let's just keep it rolling.
Thank you. And Dr. Byers, we did get one other question. Though only one case of the new strain has been detected, do we think there could be more cases out there?
Certainly there could be more. And that's the concern, is that there could be more of both of the strains, the variant strains that we've identified to date. And certainly we have additional cases that are under investigation now. And like I said, we'll be updating that information. So stay tuned.
Okay, and we got another question here. And we did already talk about this, but for Mr. Stribling, we'll be happy to re-answer it. Is MSDH conducting robust contact tracing of the Harrison County individual? Paul, would you mind re-answering that for Will?
Yeah, our investigation is ongoing, and certainly that is exactly what you have described, is what the goal is in any of these variant cases.
Okay, thanks, guys, and thank you to all the media for joining us today. We hope you all have a great weekend, and we'll see you next time.
Thanks, y'all.